is Katie and Todd from My Care Friends. Thanks so much for taking part in our research with the University of Southern California. My Care Friends is honored to be collaborating with them, and we're thrilled that you've chosen to take part in this very important research for caregiving. Today, we're going to be talking about family caregiving and managing the stress. The goals for this webinar are fourfold. First, to identify the prevalent scenarios that cause caregiving stress, understanding the impact of caregiving stress. We're going to learn tools for managing the emotional and physical strain of caregiving. And we're going to explore ways to create a sustainable caregiving plan that helps you maintain your well-being as best possible. So real briefly, we're going to share a little bit about our backgrounds, and I'm just going to bring all of these up at one time. So I'm a multipreneur, including My Care Friends, primary caregiver and patient advocate to both of my parents since 2018. Previously was caregiver and advocate for my sister, my uncle, and my grandparents. My career's been at the intersection of healthcare and technology. I'm a board member of Say Ah, which is a health literacy nonprofit based in New York City, which does wonderful things in the community. And I'm on the National Advisory Council of the American Association of Caregiving Youth, which happens to be based here in Florida, about 20 minutes from me. I'm also a lover of baseball, music, and I love to hike, which is where I met Katie. And I will pass this over to Katie.
Great. Thanks, Todd. I'm Katie Seymour, joining you here from Colorado, actually, where I first met Todd. I'm a working mom to two young daughters, 6 and 11. I have a background in tech and higher education, as you can see. And caregiving related, since 2021, I have been a caregiver and patient advocate for my sister, Jenny, who sadly passed away in 2023 after a seizure related to traumatic brain injury. I also supported my grandfather through dementia care, at the time earning my CNA to better assist, and I currently help care for both of my aging parents. I hold a master's degree in health administration and a doctorate in curriculum and instruction with a focus on mental health. My work blends caregiving, education, advocacy, and when I'm not doing all of those things, you'll find me running, hiking, listening to jazz, and watching mini kiddos soccer games during weekends.
Thanks, Katie. All right, let's dive in. So caregiving in the USA, let's look at a bit about this. So you are one of meaning everybody listening who've taken part in this survey, is one of over 53 million family caregivers. There's also 5.4 million caregiving youth, and that number is probably significantly low. Actually, both of those numbers are probably quite low. Caregivers can range. They can be family caregivers, as many of us are. They can be private duty, who are caregivers, with a medical or nursing background. They're home health, which home health aides are, typically or entirely or partially paid for by insurance, whether it's Medicare or long-term care insurance. And then there's virtual, which typically is providing companionship from afar. So who's cared for? There is a wide range: parents, grandparents, partners, child, siblings, friends. Probably this hits pretty much everybody who's listening to this. So why we're here, and when we talk about having the conversation relates to so many things when it comes to caregiving. Having the conversation about those many things helps alleviate, or at least limit, the stress and helps you live a better life. So what are these? So first is, we could be talking with a loved one who's being cared for. It's so important to be talking about having those conversations directly with those loved ones, because that's the direct source of stress that we can find. Then moving forward, we have with siblings and family members. So often we're trying to coordinate care for our loved ones with siblings and other family members. So it's really important to have those discussions about roles and responsibilities, because when it's not there, that brings on added stress. There's unknowns. We tend to take on more. We may feel guilty about that, or there's many different reasons we may feel guilty, and we'll talk about some of those later. Then there's with others who are involved in caregiving and advocacy. It's not just our family and siblings. It's also those outside agencies. We need to have the conversations with them. There need to be expectations set. There needs to be boundaries set. And then there's also, individual home health aides, the specific professionals that are a part of those agencies, or you may have hired them privately, and we need to have those conversations too. And then I'm going to let Katie chat about this one.
Yeah, absolutely. Thanks, Todd. It's so important to have the conversation. It's truly one of the most powerful stress reducing tools. Just even beginning the conversation. One of the things I think about a lot with my partner is this idea of the myth of mind reading in relationships, and this goes to partners, siblings, and friendships, and so on. Um, it's a stressful thing having these conversations, but truly it's a stress reducer if you have clear communication. I say to myself a lot, my partner cannot read my mind. So that's what I'll say about that at this point.
Thanks, Katie. Then let's talk about advanced directives and other significant documents that are needed. So we have the healthcare surrogate designation. You perhaps may already have that in place for your loved one. Maybe you have one in place. It's so important to have that healthcare surrogate, because so frequently you're in a situation with your loved one and you need to be the one that is officially able to get information. And that can also be a part of, the durable power of attorney. I'm going to put another note related to this in a moment about all of these. And then we have living will. So that's the directive. If you don't know, many of you may, it's a directive to physicians and family about how you want to handle certain situations. So you could be life sustaining. So for instance, my mom has a living will that she doesn't want extraordinary circumstances, taken. And that also ties into the DNR, the do not resuscitate, which could be in or out of a hospital, because it's not just when you're in a hospital, it could be for EMTs who are coming to the home. So it's really important to have that and have these things readily available, and that you as the caregiver know where they are. So you could have your loved one do it, but you need to have access to this and have at least a copy of it, if not the original. And then note number one is really important, that healthcare facilities, they may have additional documentation that you need to fill out. So you may have done all this and think you're fine and you're in the clear. But I can tell you from personal experience and from many conversations with other caregivers around the country that often they're in a situation at their healthcare provider. For me, it's often at Cleveland Clinic here in Florida, where they have other documentation that they need because their attorneys have said they need to have it, even though they already have the DNR, the living will, and the healthcare surrogate documents. Well, sorry about that, folks. Okay, let's go forward to a declaration for mental health treatment. That's another one that's really important. We never think, or we rarely think we're going to need that one. Right. And so it's often not even thought about, but it's something to consider, because we don't know through the evolution of our loved one's health journey what might happen and where that may come into play. And if you don't have that, it's really, really difficult to get things done properly. And as you can see, it lasts 3 years, and that may vary from state to state. So where we encourage you to look at your state and see how that is taken care of. And then we have the organ donation. Certainly we know on our driver's license these days, most, if not all states, you can be an organ donor, and it's noted on there. But there are other ways of doing that. For instance, if a loved one doesn't have a driver's license anymore, they're not driving. Like, for instance, my mom, she is not driving. She does not have a license. So we had to get her an ID. And on that ID, it can be there, but there also can be separate documentation about organ donation. And then finally, final wishes letter, which is certainly part of the end of life plan. And that's really important because for anybody who's been through that at the end of someone's life, it's a challenge to say the least. All of these documents cause such stress and anxiety in and of ourselves, but then when we're dealing with family, siblings, and so forth, it's just such a greater challenge. So this is a really important one to have those final wishes letter along with the end of life plan. Again, healthcare facilities may require certain documentation.
Yeah, real quick, one thing I would love to say about this is
Sure.
these steps might feel incredibly overwhelming as we're going through this presentation, but take it from me and what I experienced with my younger sister. It's a gift to your future, to yourself, to your family, to your loved ones. It truly does help reduce stress in moments of crisis. And it's also it's helpful to be the role model in that way. My partner and I decided to put all these documents together after my sister passed, and it was a leading example to my own parents. So it's truly a helpful tool to really prioritize this.
Yeah, thanks for sharing that, Katie. So true. I'm going to let you take this part, the time and schedule, especially since you have the kiddos and you've got your partners and you've got your parents. So go.
Yep. Gosh, managing the stress with work and time and all of the things. I will say this, and I'm sure you all have heard this, reframing your self-care, it's not selfish. Many of us struggle with the idea of self-care because it feels indulgent or impossible. I've known, I've felt that in my life, even not caring for a loved one. It's really not selfish. The definition of selfish is lacking consideration for others, but true self-care allows you to better show up for others. Going to the gym, taking a walk, reading a book, for example, having quiet time isn't luxury. It's part of, your daily maintenance. The other thing I'll say about this in terms of time is boundaries. Look at your boundaries, protect your time, protect your energy and your capacity. Without them, as we know, as caregivers, burnout is truly inevitable. Saying no, delegating tasks, people want to help. Setting limits on availability doesn't mean you're not caring. It actually sustains your own ability to care when you're seeking outside support and helpful folks that can help you. I ask myself regularly, is this helping or depleting me? I think those are good tools to really think about where you are. And the last thing I'll say about this is your rituals, anchor rituals, and we can get into this with examples. They're really cool, small, regular practices that help you regulate your nervous system and keep you grounded.
Yeah, yeah, great points. There's so much we can talk about all of this, folks. And we're going to continue here. So managing the stress in different ways. And here on the left, we have the care team, the medical history, medication schedule, and finances. So when we start looking at these, it's just so important. We have to coordinate with our care team. Part of that is knowing what the medical history is of our loved ones. They may have it in my chart or in their Epic system and so forth, but have it in your folder, so to speak. It could be electronic, it can be hard copy, whatever works for you, just have it. That's the most important thing. Family medical history is really important when it comes to this. And then medication and allergies, we all know how important that is to have a list of what our loved ones are taking and what their allergies are. And as hard as it can be, as challenging as it might be ongoing, every time we go in for an appointment I go in with my parents, much more so my mom these days, and it's a lot. They're always asking about medications. They're always asking about allergies, and it can be frustrating to go through and just confirm, but it's so important. So if there's an added medication, even if it's an herbal supplement, let them know, because you never know if there's a contraindication to something they're looking to do. So it's really important to stay on top of that and share that. That's going to help lessen the stress that you're feeling, because you're going to feel prepared and you will have that information. It doesn't make stress just magically disappear, but it will help lessen that, hopefully to a great extent. And then your ongoing schedule. Gosh, there's so many appointments and tests and lab work and everything that need to be done. In fact, this morning I just had to cancel 2 tests for my mom because she woke up and was not feeling well today. So I had to cancel two radiology tests that have to be rescheduled. So it's right when doing that and canceling them, I rescheduled them because it's really important, because if not, you're going to get in the flow of work. There's going to be that stress of, oh my God, I didn't schedule this. Is it too long? Am I waiting too long, et cetera? So make sure you've got all this information, appointments, tests, contact names, all this information that you see on the screen. And then finances. Wow, talk about one that's incredibly stressful is, know how to access those funds for medical and non-medical expenses. Have that conversation with your loved ones and about having access, not just about where they are, but having access, because they may be in a situation where they're not responsive. They cannot. They're in the hospital. You need to be able to know where that is and have access to it. So Katie, I'm going to let you jump onto this one, which is mitigating the many different feelings that can come up.
Yeah, absolutely. Yes. Let's be honest, caregiving brings up big emotions. We've got guilt, grief, anger, even resentment. Um, all of this is normal. It's important to acknowledge your feelings and give them space. Find trusted outlets, support groups, therapy, journaling, even just a friend who really listens. I think the one thing I'll say about this is we all have heard, especially today, the importance of managing our own stress. I think it's helpful to note that you don't have to do this alone. Community connection, it's truly a buffer against stress and loneliness. And just the acknowledgement that we are experiencing this, Todd and myself, we have been caregivers, we have the feelings, we understand the mitigation piece. And being a part of a platform like My Care Friends, for example, use it to be seen, heard, and understood. I think that's really what we want as caregivers, because we can't do it all.
Yeah, absolutely. Great points. And as Katie just said, that's why My Care Friends came to be, as an online community for folks. So folks feel many of these things to whatever degree and try to understand them, try to identify them. That's the first thing. Try to identify what you're feeling, because that's the first step in understanding how to deal with them. So then this is a very challenging one, which is the discussions prior to death. It's such a difficult, it's a taboo topic. People do not want to talk about death, but it's so important, and it helps alleviate that stress, and it can help for both you as the caregiver as well as for your loved one. It can bring you closer, and if it does not bring you closer, at least hopefully it will help lessen your stress, because you've had those conversations. You know what their wants are related to funeral versus cremation. You have their last will and testament, and so forth. And Katie, I'm going to let you pull this all together with.
Yeah, absolutely. I've talked a lot about self-care, this ongoing self-care. Let's talk about what helps you keep going. Self-care doesn't have to mean, and I say this, it doesn't have to mean a spa day or a week-long long expensive vacation. It might mean 15 minutes of quiet, a walk around the block, standing outside in the sun, writing in a journal. Um, Remember, caring for yourself is part of caring for others. I mentioned earlier this idea of anchor rituals. They're small, regular practices that help you regulate your nervous system. That is something that you do every day. They're not extras. These are really essential parts of managing your stress. And then thinking about your ongoing self-care, what that looks like. It could mean going on a vacation with family, but like managing those anchor rituals is a really important step in order to continue to, keep going and have this ongoing self-care component.
Absolutely. And I'll leave with one tip about one of these, because you can see all the ideas that are here. And some of these may feel like, gosh, I don't have the time to do all of these. There's one that's been really helpful for me for decades, which is meditation. And meditation, it can be just 1 minute. It can be and it may be as little as 1 minute, and that may seem trivial, but if you can just take 1 minute in the middle of a crisis or in the middle of a tough situation, you're in a hospitalization, so forth, just find a quiet place, sit in quiet, try and quiet your mind. I know it can be difficult. Put on some soothing music and just breathe. Breathing exercises are important, and that's something that we highly I highly encourage you to seek out is our breathing exercises, and there's much more. So we want to say thank you so much for your time, for taking part in this very important survey that we are doing and project with the University of Southern California. We wish you all the best, and we wish your family all the best. Take care and be well.